elevated cholesterol concentrations have been linked to atherosclerosis, coronary artery disease, and increased risk for myocardial infarction. Decreased cholesterol levels are present in various forms of liver disease, most notably alcoholic cirrhosis. Enzymatic methodology: cholesterol ester plus water, cholesterol plus oxygen, cholesterol oxidase, hydrogen peroxide plus phenol plus 4-amino-antipyrine, cholesterol esterase, peroxidase, E. HDL cholesterol test methodology: cholesterol plus fatty acid, lipids and lipoproteins, cholestanol plus hydrogen peroxide, quinonamine di plus 2-hydrogen peroxide. HDL decreases the atherosclerotic process. Increased HDL cholesterol is associated with decreased risk of coronary artery disease, and decreased HDL cholesterol is associated with increased risk of coronary artery disease. LDL cholesterol test methodology: LDL is directly associated with atherosclerosis and coronary heart disease. Test methodology: LDL cholesterol may be calculated or measured directly. Triglyceride test methodology: elevated triglyceride levels may be seen in Fredrickson type 1, 2b, 4, and 5 hyperlipoproteinemias, pancreatitis, alcoholism, obesity, hypothyroidism, nephrotic syndrome, and storage diseases such as Gaucher and Niemann-Pick. ApoA1, ApoB, and LPA. Let's start with the clinical significance. Glycerokinase. Now moving on to the test methodology. Lipase breaks down triglycerides into glycerol and 3 fatty acids. For reference ranges, glycerophosphate is converted to ADP. ApoA1 is the major protein found in HDL. It activates lecithin cholesterol acyltransferase, commonly known as LCAT, and removes free cholesterol from extrahepatic tissues. Thus, it is considered anti-atherogenic. Enzymes and cardiac assessment. Enzymes are proteins that function as biological catalysts and are neither consumed nor permanently altered during a chemical reaction. They appear in the serum in increased amounts after cellular injury or tissue damage. General properties. Enzymes are proteins that function as biological catalysts and are neither consumed nor permanently altered during a chemical reaction. They appear in the serum in increased amounts after cellular injury or tissue damage. Isoenzymes are different forms of the same enzyme capable of the same catalytic function in the body. Isoenzymes may be differentiated based on electrophoretic mobility and resistance to heat denaturation. Enzyme kinetics. Activation energy is the energy required to raise all molecules to the transition state in a chemical reaction so that products may be formed. Enzymes increase the rate of chemical reactions by lowering the activation energy required by substrate to react and form the product. Factors that influence enzyme reactions. Substrate concentration. Substrate binds to free enzyme at low substrate concentration. As long as the enzyme exceeds the amount of substrate, the reaction rate increases as more substrate is added. The rate of the reaction is directly proportional to substrate concentration, known as first-order kinetics.